with this one, you definitely need a doctor's order. And you, of course, you want to identify the patient. If you have one of those computers where if you go to a facility where they actually have a computer, you can verify the order there. But let's say we're in a facility where they actually have charts, so I would have checked my order prior to coming in. But you have an option as well. So I checked my order. Now I want to come and identify my patient, but before coming in, I did my hand sanitation, and I want to come and introduce myself to the patient. Hi, Mrs. Well, I don't know if she's a Mrs. or a Mr. Let's see. Mrs. Okay. Mrs. Smith, my name is Sandra, and I'm going to be your nurse today, okay? The doctor has ordered a Foley catheter for you. Have you ever had one before? So you want to ask them if they had one before. If not, you want to go into detail about what it is, because they have no idea what it is. So Mrs. Smith has never had one before, and many of them will ask, why is my doctor ordering this? So you want to explain to them why. So in Mrs. Smith's case, she's going to go to surgery, so they want to keep a good intake and output. So we want to make sure that that's in prior to her going in. So Mrs. Smith, because you're going to surgery, we're going to have to keep a good eye, and you're going to have anesthesia, so you won't be able to go while you're under. So we need to keep a good track of your urine, okay? That's why the doctor ordered it for you. So what it is, it's a catheter that's going to go into your private area, into your urethra, and it's going to stay in there with a balloon. It's going to keep it in place, and it's going to drain all your urine, so you don't have to worry about having to go, okay? So you want to explain it, and of course you want to provide privacy, and you want to make sure that when you grab your kit, that your kit will have the expiration date. You want to look around your package, make sure that there's no interruption to the integrity. In ours, I'm recycling, so it's going to look like this, but yours will be brand new when you guys open it. So I already washed my hands. I explained the procedure to the patient. I'm going to provide privacy, so I'm going to close the curtain, and we're going to go ahead and start. Mrs. Smith, we're going to go ahead and start, but I do want to identify your name. So identify the patient, and this is Mrs. Smith Ivana. Can you tell me your date of birth? 9949. And do you have any allergies? Okay, she's allergic to penicillin. And why is allergies important to ask her? What is in here? Yeah, betadine. So I want to make sure she's not allergic to betadine. So you've never had any allergic reaction sensitivity to betadine, right? No. Okay. Because we do have betadine in here. We use it as a cleaning agent. So we established all that. I'm going to go ahead, since I've been touching her, I'm going to hand sanitize again. Sanitize my hands, put on a set of gloves, because I'm going to check her peri area. I want to make sure first that she has a clean peri area before we start this procedure. So I'm going to put my gloves on. I'm going to expose you, okay? But I'll only expose the areas that I need to. So I'm going to check here, and it looks like she's clean, so I don't need to provide any peri care, but if it was dirty, then of course we want to provide that care first. So now that we established that, I'm going to go ahead and take my gloves off. Wash hands again. Now I'm going to start opening my kit. There's two ways you can do this. Either you can leave it on the table and then bring it here, or you can bring it here in the middle of the legs. I'm not picky. However you're used to doing it, I'm okay with that. For the case of demonstration, I'll leave it on the table for now. So I'm going to pull the package away, and I'm hoping that this has everything I need. And I'm going to use this as a trash bag. So I'm going to put that here, and I'm going to expose. Because I don't want to turn my back too much to my sterile field, I'm going to go ahead and position the patient now. So you can put gloves again depending on your comfort level. You already hand sanitized again, and you want to instruct the patient to open her legs like if she's getting a female exam. So you want, and since you have her exposed, you want to make sure that your curtain and everything is closed to provide her privacy. And if she's too cold, you might want to put a bath blanket over her, but I don't have one here, but you would want to put a bath blanket over. And there's even ways of positioning them where you can actually roll blankets on their legs. So we're not going to get that intense. We're only going to, expose here. And if she was cold, we put the bath blanket. So just like opening all your sterile fields, you want to first pull away from you. This one and side to side. The very first thing you should encounter is your sheet that you're going to put under the patient. You want to pull that away from you. you do have a 1-inch border, and most of the time your patient should be able to move. If they can't, then you're going to just drop it, okay? So in her case, because it's a mannequin, she can't move, shiny side down, I'm gonna go ahead and just position it where I'm just gonna let it drop, okay? I should have had a set of gloves next, and this kit doesn't have one. Can you grab me a set of sterile gloves? Is there any, where it says gloves, see if it's open? Right there, right on top where it says no foods or drinks. See that cabinet where it says sterile gloves? Yeah. Is it closed? It's locked. Ah. All right. Let me make me a set. I'm going to make this a set of sterile gloves. Normally this would be in a package. This is why I like demonstrating with a new kit. Okay. So this should be closed in a package, okay? So we're going to simulate. So I'm going to grab that package.
You want some?
Oh yeah. What size is that?
Really big.
9. Like a 9.
Oh gosh, I'm afloat. Okay, that's okay. I'll take it. Where's Nick? He was here all day, and now that we need him, he's gone. Okay, I'm gonna place this here. Normally, that's exactly how it should look when you open that package. Okay, so I'm gonna go ahead and grab my gloves. And this is a part where we are taking. We are gonna check to make sure that you're able to apply your gloves sterilely. Grab the one. Oh man, these are humongous. Look at that. Okay. Oh my gosh, look at this. All right. Good luck to me. All right. I already have my little trash bag. I really don't use this one, so I can just go ahead and just get rid of it. Now I'm going to get my kit ready here. Separate these two containers. Grab my betadine, open it, pour it over my cotton balls. And it's a good idea to kind of spread your cotton balls so they're not stuck when you start cleaning the patient. So I'm cleaning there. Throw that away. I'm going to go ahead and attach this to my catheter. Depending on the kit you use, most catheters these days do not want you to pre-test your balloon. So this one is the ones I use at my place. We don't pre-test. This one, they say you actually cause more harm than good by pre-testing. They have already been pre-tested prior to coming to you in the factory, so there's really no need. I'm going to go ahead and open my lube, pour it in here, throw that in there. I'm going to go ahead and lube my catheter. Take this off. And when you take this off, make sure you're holding it very good so it's not flimsing all over the area. Okay, I'm going to go ahead and lubricate. You can put that back. Okay, so now I can bring this to my area. Okay, once you have, use your non-dominant hand to open up the labius. You want to tell the patient that you're going to touch them. So I'm going to go ahead and open up, and since it is a mannequin, it is very hard with big old gigantic gloves too. Okay. It's hard to work with gloves that don't fit you. Okay. Oof. Alright, there you go. So I'm going to clean with downward strokes. Clean, dump, clean, dump, clean, dump, clean. Get rid of that. Okay, so I'm done with this. I can even get rid of this whole thing. Now this has already been lubed. Okay, you're going to feel a little bit of pressure. Okay, go ahead. And with these mannequins, unless they're lubed, it's kind of hard to get it in. But you get it in, and you try not to have the labius close on you. So let's say we got in, you get a flash of urine, you're going to push another 1 to 2 inches. You're going to go ahead and we're going to hold here and inflate your balloon. I'm not going to do this to this mannequin because it's not all the way in because she's not lubed. But let's say it's already in. I'm going to go ahead and let go now because I already did my balloon. Attach here to the leg areas. Not working here. And attach this bag to a non-movable part of the bed. Let's say it stayed there. So at this point, when you're doing this, your cleanup, you can take your set of gloves on, put on another set of gloves, wash hands, put on another set of gloves, and clean up all of your stuff. Because I have betadine in my hand, so I don't want to put betadine everywhere. So get rid of this. Position your patient for comfort. Get them nice and cozy. Call light within reach. Bed lower position. You've got rid of your trash. And you want to document. You want to document the French size of the catheter. You want to document patient tolerance. You want to document your urine consistency. How did your urine look? Was it cloudy? And the amount. Okay? So now let's say a few days went by and she's post-op day number 2. She has an order to get her Foley catheter out. Because you have to get it out as well. So you're going to come back in, check your doctor's order. If the catheter has been placed by your urologist, you never remove that. It has to be removed by your urologist. But if you placed it, it was placed by nursing can remove. So I checked Mrs. Smith now has an order for removal. So I'm going to go in, wash my hands, and talk to Mrs. Smith, go through the same process like I did earlier. So I'll skip it just for time's sake. So Mrs. Smith, the doctor has ordered for you to get this catheter out because it's day number 2 and we want you to start peeing on your own. Is that okay? Yes, that's fine. Alright, so I'm going to go ahead and wash hands again, put a pair of gloves on. And I need a syringe with me. I need a 10 cc syringe because I need to remove this catheter. So you want to bring a towel with you when you do this. Let's see, this is my towel. So let her know that I'm going to expose her. Put the towel here. And you want to get rid of the urine that's here in your bag first. Get rid of that. You want to empty that, discard in the toilet. Make note of how much is in there and what it looks like. Put this in. Let this flow on its own. You don't want to force it out. Just let it flow on its own. Let Mrs. Smith know that if she bears down, it helps. It causes this to relax. So she could either bear down or tell you it might be just a slight little tug feeling down here, and bring this out and dump it in the appropriate container. And then once again, you're going to document. Okay? So that's it. Pretty simple. So that's that with this one. Anybody have any questions? Yes.
When you expose them, and let's say they have like yeast or some type of like
That looks like they have some kind of infection?
yeah, or just basically the private area is not clean. You need to clean it. So will we use the normal saline that's next to the bed?
No, you can just use some soapy water.
Okay.
Just some warm soapy water and to provide the peri-care. Yeah, and we should be providing care anyways once we put in a catheter at least every 8 hours. Mm-hmm. Yes.
I have a question. I never done one of this ones before. I do the regular catheter, the straight catheter.
Mm-hmm.
For this one, did you? You said you go in 2 to 3 inches, right?
Once urine comes out.
Oh,
You're gonna.
that was my question.
Mm-hmm.
Okay. Never mind. You already answered my
So once urine comes out, you're gonna go 1 to 2 inches
Okay.
advance. Yeah, because you're not 100% sure that you're all the way in. You might just be right in the tip of the urethra and into the bladder. So you want to make sure that you thoroughly.
So once you see your urine, you still go.
You're gonna advance
Okay.
1 to 2 inches. Yes.
Why are we not, when we remove the fluid, when we remove the catheter, why are we not pulling it out, the syringe?
Oh, they say by gravity is best because the balloon has been in there inflated. And if you're too, oh, and another thing I forgot to tell you guys, make sure that you fully take everything out. People get creative at work and they think that by inserting more, it won't leak, because sometimes they may leak. They may put more. I have pulled this out and there's been almost 15 cc's of saline. So you want to pull out and make sure that everything is out. Yeah, it's just with the recommendations, just it's so you don't cause any excessive like on the balloon. If you do it really fast, just the integrity of that balloon. If you do it by gravity, it's just smoother. It does it on its own versus forcing it. Yes.
You say we don't inflate the balloon because it's already